everyone. Today's topic is about integrative treatment of ADHD. You can contact us at 919-869-6661 or visit us at www.ciclinic.com for more information. Let's quickly define ADHD or ADD. ADHD stands for Attention Deficit Disorder, with or without hyperactivity. With hyperactivity is ADHD, without hyperactivity is ADD. It is the most common and costly mental health problem affecting children, which can continue into adulthood. The symptoms may include early onset of age, inappropriate, persistent, and pervasive symptoms of inattention, difficulty organizing work, and impulsivity. Other symptoms may include hyperactivity, fidgeting, short attention span, risky behaviors, difficulty following through with instructions, etc. Let's look at some interesting facts about ADD or ADHD. There are certain comorbidities or disorders that happen at the same time in the same person as ADHD or ADD. They include mainly defiance or oppositional defiant disorder. Another form of it, which is more severe, is conduct disorder. Also with it goes along mood disorders, anxiety disorders, self-esteem issues, learning disabilities, sleep problems, tic disorders, etc. Having ADD or ADHD isn't all bad or negative. There are some strengths that are associated with ADHD or ADD. They can include creativity, imagination, sociability, flexible attention, interest in the environment, high energy and vitality, enthusiasm, etc. It is roughly estimated that 3 to 5% of all children worldwide suffer from symptoms of ADD or ADHD. And in the US, that number has been estimated to be between 3 to 10%. 30 to 50% of these children who are diagnosed with ADD or ADHD in childhood will continue to have these symptoms into adulthood. So it is estimated that around 4.7% of adults in the US have symptoms of ADD or ADHD. ADHD is more common in boys than girls with a ratio of 3 to 1, and the peak age of diagnosis is between 8 to 10 years of age. Boys are more likely than girls to have hyperactivity as a presenting symptom. Here are some more interesting facts about ADD and ADHD. Twin and adoption studies have shown that ADHD to be highly heritable. And why we have this gene is very interesting. It is postulated by some researchers that as humans migrated out of Africa around 50,000 years ago and moved across the planet, ADHD genes linked to risk-taking, rapidly shifting focus, and adventurousness offered advantages to surviving such migration better. So this gene offered advantages, and that's why these genes persist now. We should also know that smoking cigarettes and drinking alcohol during pregnancy has been linked to an increased risk of developing ADHD in the fetus. One of the main ways ADHD or ADD is treated in the United States is through the use of medications such as stimulants. If you look at the estimated number of children who were taking Ritalin in 1970 at 150,000, that number has markedly increased to 2.5 million in 2003. So let's look at some possible explanations for such a sudden rise in the use of medications. It is possible that we are getting better at diagnosing children and adults with ADHD. Another possible explanation is that there are more children who have now ADHD compared to the past. Another explanation may be we loosened the definition for the diagnosis of ADHD, and therefore there are more kids who are being diagnosed and treated. And another explanation is that we are misdiagnosing certain conditions as ADHD and treating children with ADHD medications. So there are many conditions that can be misdiagnosed as ADHD. They can include anything from post-traumatic stress disorder or other trauma-related disorders in children, depression or bipolar disorders, anxiety disorders, oppositional defiant disorder, intense or difficult temperaments in certain children. Learning disabilities can be misdiagnosed as ADHD. A child who is gifted, who easily gets bored, can be diagnosed as ADHD. Boredom can do the same. And a misfit between the child and school or the child and the teacher can lead to behaviors that can mimic ADD or ADHD symptoms. To make things more complicated, there are certain medical conditions that can mimic ADD or ADHD or worsen the symptoms of ADD or ADHD. They can vary a lot and range from sleep apnea to iron deficiency to lead toxicity, thyroid problems, poor nutrition, and food sensitivities. Any physician or provider treating children with ADD or ADHD should be looking at these conditions and ruling them out as part of the workup. So let's look at some of the common medications used in the treatment of ADD, ADHD. There are different groups. The most common one are called stimulants. They are either Ritalin or Ritalin-like substances, or Adderall or Vyvanse or similar medications to them. There are non-stimulants such as Strattera, guanfacine, clonidine, and there are other medications that have potential use such as Wellbutrin and the tricyclic antidepressants. And one of the main problems with the use of these medications, especially since they need to be used on a regular basis, is their potential side effects. They can vary a lot and range from decreased appetite, especially with stimulants, trouble sleeping, abdominal pain, headaches, tics, unusual behaviors, even hallucinations. These side effects will generally stop when the medication is stopped. An integrative approach to the treatment of ADD, ADHD may include medications, but it is not the first line of therapy. In this approach, it is important to see the child in the context of his or her family, friends, school, community, and not just someone with a set of symptoms that one is trying to fix. Sometimes a simple change in the home environment, school, or teacher is more important than any medication. So in the integrative treatment of ADD, ADHD, environment plays a very important role. It is important to consider schools who understand this condition and have plans and policy in place on how to address the needs of children with ADD, ADHD appropriately instead of punishing them. Smaller classes with a low student-to-teacher ratio with age-appropriate structure is preferred. It is important to provide a safe and structured environment at home, have consistent routines, break down tasks into smaller steps, and reward positive behaviors. It is important to limit television and video game time and the use of cell phones. It is important to avoid exposing children to lead, secondary hand smoke, and pesticides. It is important to use a full spectrum fluorescent lighting indoors as much as possible. So let's look at some lifestyle changes that can help to treat children with ADD, ADHD condition. First, in the diet, it is important to eat whole foods rich in omega-3 fatty acids, as well as foods containing high amino acids, vitamins, and minerals. A good provider or nutritionist can help you determine which foods these are. Also, maintaining a steady blood sugar by eating regular meals with high protein and good fats can be important. There are certain foods that are recommended to be avoided. They include sodas, trans fatty acids, artificial colors, especially yellow and red dyes, flavors, sweeteners, and preservatives. Reducing inflammatory oils such as omega-6 fatty acids that are found in oils such as safflower, sunflower, corn should be reduced. Increasing daily activity and exercise, preferably outdoors, is important. Getting adequate sleep for the age is important, which is something that I'm finding more and more being an issue with our children. Also, helping our children to reduce their stress level and regulate their emotional state is very important. When it comes to diet, there are some controversies regarding the best diet. In my opinion, it is very important to diagnose and eliminate any food allergies that might worsen the ADD or ADHD symptoms, especially dairy, soy, nuts, and peanuts. There are multiple diets out there for ADD, ADHD, from Feingold to fail-safe diet, that in one way or another they try to eliminate certain ingredients such as salicylates, amines, tyramines, glutamines, etc. And my experience is a certain number of patients may respond to such diets. These diets are patient-specific and should only be attempted under the care of a good provider who is familiar with diets and nutrition in children. Another step that can be taken in the treatment of children with ADD, ADHD is mind-body therapy. Considering psychological counseling, such as cognitive-based therapy or family therapy, especially in children with mood or behavioral disorders, are important. Also considering other mind-body therapies such as meditation, yoga, tai chi, massage therapy, or joining a social support network can be important. There are certain supplements that can be useful, including essential fatty acids, iron, calcium, magnesium, vitamin B6, zinc, and other supplements. These need to be prescribed and recommended under the care of a knowledgeable provider. There are also certain herbs that can be useful in the integrative treatment of children and adults with ADD or ADHD, such as lemon balm, valerian, chamomile, etc. they too should be only prescribed and recommended under the care of a knowledgeable provider and doctor. An exciting non-medication treatment of ADD or ADHD is the use of a relatively new method called EEG neurofeedback. The studies on the effectiveness of this method for the treatment of ADD, ADHD seems promising. The EEG neurofeedback method can be used to train children to alter their brain waves by feedback techniques, thus learning how to focus and pay attention. A few small studies indicate effects comparable to stimulants, but longer-term control studies are needed to confirm it. The big disadvantage is the cost, which is not covered by most insurance companies at this point. So, in summary, we need to be careful not to overdiagnose ADHD or misdiagnose it. When we do make a correct diagnosis, we should seriously consider at least exploring non-pharmaceutical options, which are certainly safer and maybe as effective as medications. And medications should be used sparingly and with caution. Here are a list of a few web resources that I hope you will find useful. I hope you found this talk useful. To contact us for more information, you can call us at 919-869-6661 or visit us at www.ciclinic.com. Thank you.